Dr. Chunga, our esteemed friends from Australia, members of the Critical Care Network that are here for the training, distinguished participants. Ladies and gentlemen, first, thank you for getting an opportunity to attend this particular course. It's a big event for us, EMSA, to be here. But the details of this particular workshop were given by the workshop director a little later. Let me just make a few comments which I think are relevant for this workshop. My first comment will be on quality of care. Not just care, but quality of care. A few years ago, medical doctors would go on strike because of lack of equipment and lack of infrastructure. We had a number of strikes. The minister will remember about this. Doctors going on strike for various reasons. But at the moment, if I may say so, it's highly unlikely that it will happen. Why is that? Today, public institutions, public hospitals are in the forefront in terms of infrastructure and supplies and technology development. Now I'm talking about MOI, JKCI, Benjamin Mkapa. These are public institutions that are, if I may say so, that are in the leading edge as far as delivering quality care is concerned. But to make a lasting improvements in quality of care, we need to look at another aspect. We need to start looking at how we can transform our healthcare people to a new culture, a culture of quality. Sio bora liende tu. It has to be with quality. Now, this new culture should uphold a certain standard, a standard which all of us will need to uphold. So that if I go to the smallest health center in the Dodoma region, I should get the same care that I would get if I was in Singida or if I was in Mwanza. There shouldn't be such gross disparities in terms of care. So, as far as this holds, is that we need to establish a certain element of a standard of care, looking at our friends as well as a comparison. But we don't have to be the Chinese model or the Japanese model, or for that matter, the Australian model. But it has to be of a standard that we can compare. It's only when you have a standard that you can compare with others can you really improve. You have to have a standard, otherwise you can't improve. So this is what we are embarking on, trying to develop a culture of quality, a culture of standards. EMSA is pleased to be associated with Benjamin Mkapa, especially in this element where Benjamin Mkapa is becoming a training institution. We are happy to be associated with Benjamin Mkapa. We will give what we can in terms of the training. Now, it is important that not only do we provide infrastructure and technology, but we should train the people who use this technology. Last year, a study was published which showed a great disparity. Kwamba kuna majengo mapya, kuna vifaa vipya, lakini watu ni wale wa zamani. Tumeshift watu kutoka casualty wakaenda kwenye new system. Lakini we have not trained those people to use the equipment. So what has happened? We have good equipment. The government has invested in a lot of new equipment, but there is no one who can use that equipment. So what happens to the equipment? It lies fallow. After 1 year, it is discarded. This is a problem that the ministry is very aware of. And we're trying to resolve this particular issue. I would like to extend my sincere appreciation to the international faculty. We have had a very good understanding with our friends from Australia. They have come here, some of them have come here twice to train with us, giving our training an international flavor. Not only that, trying to explain to people that what you are getting here is the same that you would get in Australia. It's the same that you would get in South Africa. Wherever you go, these courses are trained in the same way. Standards are being developed. Quality is being improved. I also should thank the ICU teams that have come here from different places. We've taken you out of your comfort zone to come to Benjamin Mkapa, either to present or to attend to the training. We are very grateful for the time you have spent. We also have our own faculty that travels from one place to another to try and deliver the same kind of training. And we've trained our staff, our faculty, to a certain level. We expect them to deliver that level. We are always checking to make sure that they're actually delivering the level that they need to deliver, so that standards are maintained at every level where we train. Once again, may I say thank you to the Ministry of Health and Chief Professor for allowing us to come to Benjamin Mkapa. All we can say is this is not our last training session. We hope to come if the administration is willing to come and try to maintain what we have started. But every one of us who has attended this course must be able to show when you go back that you have learned some new skills, that you've learned some new skills that you can deliver to our patients, that you should be a different person than the person who came here initially, that you have gained something when you attended the course. May I now call on the workshop director to say a few words. Thank you.
Thank you, the Chairman of the Board, and thank you, Yes of Mana, for giving me this opportunity, Dr. Mr. Silvanus. The protocol has already been observed, and gratitude to the Minister of Health for his leadership and on emergency response, strategic guidance, infrastructure development, and implementation of emergency services has already been mentioned by Dr. Fire. I would like to convey my heartfelt gratitude to the Executive Director of Benjamin Mkapa for his unwavering dedication and commitment to patient care and strong advocacy for emergency medical care. Without the leadership and the commitment, this workshop would not have been a success. As we say, majority of the participants actually came from Benjamin Mkapa, and especially the nurses. Similarly, the head of departments from the emergency ICU have been trained so much to allow participants to come to the training while they're covering their shifts. This is something that we want to commend to the Executive Director. Commendation I would like to give to our association, the Emergency Medicine Association, for the pioneering of the establishment of the Emergency Care Training Center, a section facility that continues to shape a strong culture of healthcare excellence. I extend my sincere appreciation as well to our colleagues, international faculty, intensive care specialists, critical care nurses from ICUs and at the national level who traveled all the way to share their expertise and transfer critical care knowledge to the central zone. Your contribution have been invaluable. Dear guests of honor, in this audience, we have made a remarkable success. We have brought in 68 healthcare professionals, including 20 doctors, 33 nurses, 80 critical care nurses, 4 emergency physicians, and emergency physician, and 3 international physicians from Australia. These participants are coming from various departments, from surgery, ICU, anesthesia, internal medicine, obstetric, and dialysis, and have traveled from Dodoma, Songwe, Dar es Salaam, Zanzibar, Arusha, Moshi, Singida, Morogoro, and Njombe. This diverse participation highlights 3 key important factors that we one time highlighted when we visited to the ministry. The ministry emphasis on training more nurses as they form the backbone of emergency and critical care services. The recognition of emergency and critical care services are not limited to anesthesiologists and emergency physicians. Critical ill patients require immediate and comprehensive care from all healthcare professionals. It is therefore imperative every physician and nurse to be equipped to provide emergency and critical care services, as we continue to lose many patients outside EMD and ICU, these are actually because of preventable gaps in these kinds of services. This also reflects the national commitment to advancing emergency and critical care services. Dear guests of honor, when we taught these participants, we had one feedback that we could share with you, probably for our training, as we know you're spearheading the training all over Tanzania. The training has given us a positive reinforcement, and especially for the urgent need of further training on basic emergency care. Many of the participants showed that they have gaps on very emerging services, basic services, for which we feel that these are important. The most identified gaps is related to the basic skill of knowledge, essential competence that include healthcare workers to utilize and advance equipment, infrastructure that the government has already invested in. In this regard, we commend and support the Ministry of Health as strategic plan for emergency, essential emergency and critical care service, ECC, that we have got a strategic plan already in place. EMSA is committed to complementing the government's effort. As you can see, in 2024, EMSA trained 760 healthcare providers, and in 2025, we are looking forward to train 800. Up to this moment, we have already trained, since January, we have already trained 136. 136 participants. Following the directive of Professor Abe Makubi and the executive director of Benjamin Mkapa, EMSA will return to Dodoma. And we would like to equip more than 100 additional staff members on cardiovascular emergency and critical care, focusing on neuro-intensive care, as well as basic and advanced life support skills. However, beyond the training of participants, EMSA is committed at empowering specialists to become trainers at Benjamin Mkapa Hospital, ensuring sustainability in critical care education. Dear guests of honor, without your support, without your guidance, without being behind us, we may not be able to fulfill these great achievements. We would like to expand our impact and reach more healthcare providers, and for that reason, we seek your support in the following areas. Endorsing the project to regional and district hospital where emergency and ICU infrastructure has been established. Recognizing the team of emergency and critical care training network, which includes now, we've got 34 specialists and 14 nurses. Hosting of this workshop at national, regional, and district hospital, and granting permission for trainers to travel. sometimes they have to use their leaves for them to travel to train. So I understand that upon having your support, they may be given permission to come and share their knowledge to transfer to other regions where the primary healthcare facilities are. We'd like you to support the participation, staff supporting participation in training programs and advocating the government collaboration in this initiative. Dear guests of honor, your unwavering support and leadership in this initiative underscore the critical role of training in the transformation of emergency healthcare in Tanzania. Once again, I extend my heartfelt gratitude to you for the dedication, time, and relentless commitment to strengthen emergency and critical care services in Tanzania. Thank you. Having said that, I'd like to call upon Professor Makubi to say thanks and welcome the guest of honor.
Thank you, Dr. Ramadhani Chunga, the course director on emergency medicine and critical care services. Dr. Erasto Silvanus, the director of emergency and the critical care management from the Ministry of Health for this closing event. The chair of EMSA board, Dr. Alfaya. Dr. Ramadan is the course coordinator, international faculty from Australia, local faculty who are here, participants, my colleagues from Benjamin Kappa who are here as part of the management. Good morning. Good morning. Good morning. Good morning. I would like to take this opportunity to express my gratitude and appreciation to EMSA for being able to organize this event for training our health care professionals in critical care management and emergency medicine services. This has been a very wonderful event this year, as our host has been trying to improve the quality of care to meet the demands of our patients. As we heard from the chair of EMSA, our main interest now is to improve the quality of care within the health sector. And that's the priority number one. It's not just a matter of having a staff and the patients and having buildings and equipment. Our patients now are really interested to see what is coming out from these buildings, nice buildings and nice equipment, and that is the quality of care that we provide to them. And with my experience as a physician, I understand that the quality of care starts mainly at the emergency department when we are talking about the hospital environment. If the emergency care and the critical care is poor, you don't expect much improvement in terms of quality of care among your patients. So with these efforts from EMSA, supported by the Ministry of Health, I think you are going to have a positive impact on how we are caring our patients. And when we go back to our hospitals, we should be able to see some positive changes on the way we care our patients. I would also like to extend my appreciation to the Ministry of Health for being able to coordinate and direct all these kind of workshops across the country. Not only that, they are supporting the training, but also they have given us the equipment and even facilitated the investment that we see within this hospital in terms of having the emergency care training center that we have. So I want to thank the Ministry of Health and all our stakeholders, including EMSA and Airport, for this kind of support. Asanteni sana. The history of emergency medicine has evolved a lot for the past 10 years. In 2010, our focus was on Muhimbili National Hospital. That was the only center that we are proud of providing emergency medicine services. And all our efforts were directed to that hospital. But in the past 5 years, now these efforts have been branched to various zonal and regional hospitals. And I'd like to commend the efforts which have been done by the Ministry of Health. This is a big investment for our country. Not many countries in Africa now have this kind of network of emergency medicine and critical care. Most of the countries are really struggling a lot. But with these efforts from our government, through our ministry, we can see now clear efforts and determination to improve the care of our patients through emergency medicine department establishment and the support. So I want to ask again the Ministry of Health to continue capacitating our staff, capacitating our zonal and the regional hospital and the district hospitals which have emergency department units. I understand we need resources, but for the staff, what we need from you is your commitment and your willingness to change the situation that we have now. So I expect after this course, when you go back, as I said when I was opening this workshop, something has to change to your hospital when it comes to quality of care. I also want to thank our faculty members from Australia and also from Tanzania for facilitating this course. I know you have other commitments, but you have managed to set a few days for us. Thank you very much for that. And lastly, I want again to thank EMSA for accepting my request, which I made 3 days ago, about extending this kind of trainings in the future for Benjamin Mkapa staff and other staff who will be available to come.
Thank you.
As I said, we are doing a lot of complicated cases here. We also need advanced training, particularly on stroke, neurotrauma, polytrauma, and other critical illness patients with multiple problems. So we are not here to just to serve very simple cases. We normally see very complicated cases. So we need to equip our staff with advanced skills and knowledge so that we can comfortably manage these patients. So thank you very much for accepting that request, the management.
Thank you.
And I want you again to commit my team, my Benjamin Mkapa also team, to this workshop. We'll continue supporting them. And I want to assure the Ministry of Health that we are here to support their guidance and their directives. Whatever they tell us when it comes to supporting emergency medicine and the critical care service, we are ready. We are ready also to support other hospitals, the nearby regions, and even from other countries. We are here to support whatever we think is of the interest of the Tanzanians. So with those few remarks, now we'd like to welcome our guest of honor to speak to the audience. Karibu Dr. Erasto.
The Executive Director, Professor Makubi, Dr. Sylvester Fire, Dr. Ramadan Chunga, Director of Training, Directors of Benjamin Mkapa Hospital faculty from Australia, most welcome. Our trainers locally here, and those are coming from different regions, participants from all the regions that are here. Good morning. Jamhuri ya Muungano wa Tanzania. I'm very happy to be here to witness what has been ongoing since Tuesday. Of course, there have been preparation even before that. I thank also Benjamin Mkapa for hosting this training for all these regions.
Thank you.
Thank you very much, Professor Makubi, for your leadership. And just, I know you can't say this for yourself, but Professor Makubi is at the core or at the roots of what you are seeing here, because he was permanent secretary, and all this happened by his instructions. Yes. Oh, we thank you very much. And Benjamin Mkapa also, just to tell you, you are very lucky to have this kind of leadership. As those of you who are here, you know, he's very committed, revolutionary. He wants to see best care for the patients. He's very people-centered. He's very patient-centered. You can be witness. Yeah? Aren't you the witness? Benjamin Mkapa team? Yes. Yeah, so you are very lucky. Just take his lead. I'm sure customers and patients who are our relatives, who are ourselves, will be happy to come to Dodoma, because we know our lives will be taken care of. So we thank you for also hosting this training as part of your commitment. I know. Thank you very much. We also thank EMSA for organizing this. Thank you, Dr. Winnie, as well, as part of the organizing team, and to make sure this training is happening. Just a quick overview of importance of emergency care and critical care. You know, this one cuts across all professional health. It's not in one place. Emergency care is everywhere. And the burden of diseases that would bring emergencies, real emergencies, are also in very high ranking in the top 10 diseases. In Tanzania, I looked at Tanzania, in the top 10 diseases within these 4 years or 5 years, apart from the infectious diseases like tuberculosis, HIV, etc. But stroke is at the top of the list. Ischemic heart diseases are at the top of the list. Road injuries, road traffic injuries are there as well. Other emergencies of obstetrics during birth traumas, etc. Those emergencies are everywhere. They are not only at the emergency department. Infections like lower respiratory infections are all over departments or different specialties. So we are at the core of life-saving. We are the life-saving area where if we are not aware that we are at the critical area, we are not doing justice to our profession. So we understood this, even globally. You can see across the demographics, the number one cause of deaths worldwide at the age of 45 to going up to all ages, older ages, ischemic heart disease, ischemic heart disease, cerebrovascular diseases are at the top 2, you see, at that age, globally. And these are the ones that are coming every day with emergencies. Strokes, of different nature. We have at the age of 5 to 30 years, we have road traffic accidents at the number 2 causes of death worldwide. And when we say worldwide, Africa takes 60% of all the deaths. But they are the least region with few vehicles. But we have almost 3 times many deaths compared to the world. So we have all the reasons to strengthen our emergency care. So I just wanted to remind you of that. The government understood this, and through the Ministry of Health, we together, and the guidance of our minister, we pushed to the establishment of emergency departments across the country. From one department that Professor Makube has alluded to, at the National Hospital, to more than 121 departments through 4 years. So this is a big step. This is from this is at the level of primary health care, which means the district hospitals, but as well as referral hospitals at the regional level. So all our regions, 26 regions, actually we have 29 regional referral hospitals, because in Dar es Salaam we have 3 of them, almost 4 of them in one region, so they make it a bigger number than the 26 regions. And so all this burden, all this investment that has been put, new emergency departments, but we equipped them. You know, all this equipment of emergency departments alone has taken 62 billion Tanzanian shillings across the country. A lot of investment has been done, but we have created a big demand of the capable, knowledgeable, or skilled human resource. So what EMSA with BMH are doing right now is to try to close that gap step by step, bit by bit. So we thank you very much. We need teams that can run these emergency departments, can operate ICUs. I did not mention about ICUs. We had very few ICUs. Actually, only which you can call ICUs were 8. Right now, we have 45 fully functional ICUs, that are new ICUs, I mean, with equipment. So, and we have, that is at the level of regional and referral hospitals. And we have 28 new ones at the level of primary health care. So all these investment need teams that are knowledgeable and skilled. I'm happy that today we are witnessing that we have trained 60, is it 68?
68.
Yes, 68 people who are here, and I'm glad that you have put nurses as at the center of this training. I thank you very much. Pige makofi. To be very truthful, nurses are the engines of the operations in the hospitals. So if they are at the center of the training, we will be doing justice to our patients and to ourselves, because they are also patients in any time. So I thank the team for that. So I want to assure you that the government is committed to improving more emergency care. Of course, you understand the essential emergency and critical care strategy is already out there, and we have to, with your support, we ask you for support to join hands with the Ministry of Health and other partners to push this agenda. The basic emergency care is very important. To save somebody's life, you don't need to be a specialist of cardiovascular surgery. You don't need to be a specialist of critical care. You don't need to be a gynecologist. You just need to be oriented. As long as you are a doctor, or as long as you are a nurse, or as long as you are part of the medical team, there's something basic you can do to save lives, including quick positioning, just delivering oxygen, just knowing this is a mask I can put it this way, make monitoring, close monitoring, checking blood glucose on time, giving glucose supplements if needed, giving fluids to make sure the electrolytes are okay. Those are basic things you don't need to be trained for 5 years. People die out of aspiration because nobody took care of them. So I want the team who which is here, the nurses who are here, the big team. I'm very, I put all my trust on nurses. If they are good, we will be safe. We will be safe. Of course, the culture has to change, that everyone in the hospital, someone has to trust you, someone has to depend on you. And I'm sorry, some of our colleagues who are the more you train yourself, the more unavailable you become. Yeah, like you can't come on call. Yeah, like you can't come to the hospital to sleep at the hospital. You feel that you are too big. You know, you just leave this thing to the juniors. If you are a sick person and people give up on you, they just send you juniors, will you be comfortable? No, we don't. Sometimes we don't think that we are also patients. We just think that we are formidable. We are infallible. That's why we send juniors only. I'm sure Professor Magubi also might be getting some challenge. Some of the bigger you are, the more trained you are, you become very hard. You know, he has to put a lot of efforts. I know, I'm not giving a BMH as an example. I know my colleagues. We need to change that. We need to be available. The more you are skilled, the more you are trained, be more available. Okay? Be more available for patients. So I call upon all the team who are here to understand the uniqueness of emergency care. That perspective itself, the 1 hour, the 5 minutes, is very important. It is unique. Yeah? It means a lot if you are a patient. It doesn't matter if you are in emergency department or in surgery or in a ward, HDU or whatever. When someone comes, that moment that they arrive is the moment you can show them that you care for them. You can quickly understand if they can survive or not without your intervention. Yeah. So I call upon everyone to have that mindset. I remember Professor Makubi alikuwa anasema huwa mnajitambua, tujitambue. Hii lugha haitumii huku. Tujitambue. Hajawahi kuisema hata siku moja. Anaitumia, anaijua sana, ila anaipenda, huwa automatically ndio anaisema kwamba mtu anayejitambua, if you understand why you are there. Why are you there? And then you will do what is necessary. You will do what is needed of you. Okay? So I call upon everyone who is here to understand why they are, where they are. Okay? So tujitambue, and the commitment is very important. This training will be worthless if we are not committed. We go back, we just put down everything we have, and then business as usual goes on. This is not what we expect of this good team that I have seen here. Timely decision and timely interventions. Hizo ndio vitu vinaleta difference kwa wagonjwa. Kule amefika hapo, make time. Sawa. Emergency medicine inafundisha kitu kimoja ambako ni unique of other specialties. They teach us to think of the worst thing that can happen to this patient and can kill this patient within 5 minutes, within 3 minutes, within 1 hour, within 30 minutes. They have that understanding. So that's why in emergency departments, if you are really trained, when someone comes, you rush to that patient. You make sure if someone is not breathing correctly, everything that can cause someone not to breathe properly and can kill the patient, to make sure it is not there, or you make sure it is intervened, it is taken care of. And then you will settle for the rest. If you see this one is not there, this one is not there, this is not there, this is not there, then okay, whatever is remaining, this guy cannot die. This cannot die today. That is the mindset of this team that should be in your mind. Make sure patient cannot die on you. Make sure, do all you can. Na akifariki sikitika, yani jisikie kwamba I say, what did I do wrong? What could I have done to save this patient? Isifikia tu sasa vifo ni kawaida, yani wewe una certify tu. Lakini ukiangalia, did you do all that was needed? Unakuta hata ambulance inafika, wewe uko ndani tu unaendelea kuhudumia mgonjwa mwingine ambao unajua kabisa yeye anahitaji fluid tu na hawezi kupata changamoto yoyote, utaweza kurudi baada ya dakika 5, you can continue with IV fluids. Someone is coming there, you don't know what is wrong with that patient. The ambulance is there, you don't bother. Yeah? And then you are called, you go there without nothing. We just go and look and then come back. You take the stretcher. That time, you are losing. Kwa hiyo naomba sana ongea kwa msisitizo sana, kwa sababu ni vitu ambavyo mimi binafsi nilipokuwa condition nilikuwa vinaniuma sana. Mimi nilikuwa natamani niende nikatibu kila ward, lakini I couldn't. You can't be everywhere. Jana Dr. Fire tulipewa mfano mmoja, tulikuwa na Dr. Fire mahali, tukapewa mfano mmoja nilifurahia sana kwamba huyu mtu aliyokuwa anasimulia anasema walivyokuwa jeshini kwenye kambi yao. I'm speaking in Swahili because it will be sweeter in Swahili, then I will translate. I'm sorry. Yeah, kwa hiyo akasema kwamba wakiwa kambini siku moja usiku yule kamanda wao akaja akaita fulani kwa sauti ya chini, si fulani toka nje. Waliosikia walikuwa form tunaenda kutrainiwa jeshi JKT, wakatoka wachache, wengine wamelala tu maana hawakusikia. Kwa hiyo yule kiongozi wao akawapanga wale waliotoka, akawaambia nyinyi mmekuja mkaje wenyewe? Wakisema si tulisikia sauti yako tukaje. Sasa je, ingekuwa vita, kwa nini hamjaamsha wenzenu? Akawapigisha adhabu siku nzima kwamba saa nyingine kuwahi peke yako haina maana. Sawa, hakikisha everyone mpo pamoja, kama ni vita mwende wote mtapigane. So if you are trained here, you feel you are very good, I'm very good at intubation, but if you are alone is useless. Simeelewa? Haina maana wewe idara nzima wewe tu ndio unajua kukanyulate central catheterization. Haina maana ukiona huko peke yako ujue kuna shida. I can shout. Kwa naomba make sure jamani, you are not alone anywhere. Okay? Make sure whatever skill that you have, everyone in your team who can learn that skill gets that skill, so that you are also happy when you get sick, someone will take care of you. When your child is not sick, will be taken care of. Hivi ni wangapi hapa ambao mnaogopa sasa hivi hata mama yako akikupigia simu hapa, mwanangu naumwa, niko Tabora hapa naenda hospitali. Hamna mtu ambaye atashindwa hata kwa kwenye kikao hapa aende kupiga simu mpaka ajue daktari gani amtafute. Je, mpo hapa? Simple. You don't feel safe kwa sababu tunajijua uongo kweli. Lakini we need to change, and that one cannot be changed by one person. So you can't be just good yourself. Sababu nilikuwa natoa mfano, mimi nilikuwa natamani niende kila wodi sababu nasikia maumivu. Mgonjwa unamtibu vizuri, unapambana naye, afu kimpeleka mwingine hana hiyo agency kabisa, anamwambia mwekeni hapo. Sasa unawaza nikimwacha hapa itakuwaje? Na effort zote tumepambana masaa 6. Tumemwituate mgonjwa anahitaji event, amempeka paka kwenye event. Una wasiwasi ukiondoka ataendelea kufanya zile tracking na kuangalia nini? Unaenda unarudi. Sasa how can you do that in the whole hospital? It means we need everyone to have that mindset kwamba this patient is very valuable life. It is somebody's father, it is somebody's wife, it is somebody's sister. Kwa natamani msitamani kuona mtu anakufia mkononi mwako kwa sababu huyo ni ndugu wa mtu mwingine. Mimi nasema hiyo kwa uchungu kwa sababu mtoto wangu alipata shida siku moja, nikagundua kumbe watoto wanauma. Ndio akasema kumbe kuna wazazi unashangaa na kwa mkali saweza akamdhuru hadi mtu kwa sababu unamuumiza mtoto wake. Mtoto wangu alichomwa sindano vibaya, akapata sciatic nerve injury, akaparalyze mguu. Lakini sio kwa sababu ya bahati mbaya, ni kwa sababu ya uzembe. Yaani mtu aliyotaka kumhudumia amechoka line, akaamua kuweka 10cc ya ceftriaxone kwenye buttocks ndogo ya mtoto mdogo ili arahisishe tu kwa sababu ilikuwa usiku. Asa, how can you do that to somebody's child? Now we go comfortable too. And this is not happening to my kid, or did not happen to my kid only. It's happening every day to other people who don't care for other patients. So your training here, emergency care, make sure that you don't waste anybody's life if you can save it. Simeelewa? If you can save it. Kwa hiyo huo ndio ujumbe wangu mkubwa. So let us build the culture of care, the culture of patient-centered, and this is what early emergency is all about. Everywhere you are, surgeons who are here, obstetric and gynecologists who are here. I'm very glad that you put together all these teams, because we are one. We are one team when we depend on each other, and there has to be a continuity of care. So thank you very much. So just to reassure you as I finish, that the government is committed. Our support is guaranteed. We'll continue supporting this because it's our duty to make sure the health of Tanzanians is that we have a healthy society, and together, government cannot do it alone. It needs private institutions, private organizations, training organizations like EMSA, and other professional organizations. So we are very committed to support. We continue supporting all the plans that are ongoing, and we continue supporting BMH to bring more to training, a very good center that you have started here, Professor Maku. So be prepared to receive everybody that is coming from different regions. Even in Dodoma itself, from all these at primary level, they'll be coming. Continue teaching them, give them the support that you can, so that Tanzania can remain, can become healthier than we are. With those very long remarks, thank you very much for listening. Now, all the best in your closure.
Before we proceed, I would like to have the high table state as the training coordination has arranged recognition to the government and recognition to the Benjamin Kappa. And I would like to hand this to Dr. Fire to hand it to you so that you can give to Benjamin Kappa.
Okay. Tusogee wapi? Huku. Nitoke.
Niweze kumpa. This is for Benjamin Kappa. Asante sana.
Thank you, Benjamin Kappa, for support. Thank you so much. Then I would like Dr. Fire and Professor Makubi to assist him EMSA in giving talking to the Minister of Health in recognition of the leadership, and especially the ladies and children. Thank you so much, Minister of Health. Thank you so much.
Thank you.
Thank you. Having said that, now the following, the next session will be photos, and the first session. Thank you so much. The next group will be nurses.
Na mtazamaji wa SQF TV, hivyo ndivyo tupo katika ukingo wa mafunzo ya matibabu ya dharura na huduma za wagonjwa mahututi ambayo ilikuwa yakitolewa hapa katika hospitali ya Benjamin Mkapa jijini Dodoma. Na sasa hivi tukio la upigaji wa picha linaendelea. Washiriki pamoja na wakufunzi na waandaji wa tukio wako mbele kwa ajili ya picha za kumbukumbu ya tukio hili.
Thank you. The first group, the second group.
Na miongoni mwa vitu vya pekee ambavyo vimefanyika leo katika ufungaji wa mafunzo haya ni hotuba nzuri ya mgeni rasmi kutoka Wizara ya Afya, ambaye amewasisitiza wote waliopokea mafunzo haya kuyatumia ipasavyo.
Thank you so much. Now can we have the doctors? One group.
Na wanaoenda mbele kwa ajili ya picha ni madaktari ambao wamepokea mafunzo haya. Watajipanga mbele kwa ajili ya picha ya kumbukumbu pamoja na mgeni rasmi na waandaaji wengine wa tukio hili.
Thank you so much. So lastly, the coordinators of the workshop, EMSA staff, Benjamin Mkapa.
Na sasa wanaokwenda kupata picha ni waandaaji wa tukio ambao ni EMSA, Emergency Medicine Academy. Waandaaji pamoja na wenyeji wa tukio ambao ni Benjamin Mkapa Hospital wanakwenda kwa ajili ya picha ya pamoja.
The guest was honor. Thank you so much for your time. But before you leave, I think this international faculty may want to have a photo with you alone, if you can allow that. Please, international faculty, a photo with you with the guest of honor.
Na walikuwepo wakufunzi kutoka mataifa mbalimbali, wakufunzi wa kimataifa, na wanaelekea kupata picha ya pamoja na mgeni rasmi pamoja na waandaaji wa tukio hili.
Thank you, colleagues. After here, the next occasion is going to be breakfast, and then we go back to the training. Thank you so much.
Na mpaka kufikia wakati huu sisi SQF TV hatuna la ziada kutoka kwenye ukumbi huu wa mikutano uliopo hapa Benjamin Mkapa Hospital. Ni mafunzo ya matibabu ya dharura pamoja na kwa wagonjwa mahututi ambayo yalikuwa yakiendelea hapa katika hospitali ya Benjamin Mkapa. Ni washiriki zaidi ya 80 wamebahatika kupata mafunzo haya yaliyokuwa yanatolewa kwa ufadhili na usimamizi wa taasisi ya EMSA, Emergency Medicine Services Academy, ambayo iko hapa nchini Tanzania, na madaktari pamoja na wauguzi mbalimbali kutoka sehemu mbalimbali za Tanzania wamehudhuria mafunzo na wamepata taaluma au wameongeza vitu kwenye taaluma yao ambayo vitaenda kuwasaidia. Na tumesikiliza hotuba nzuri ya mgeni rasmi ambaye alikuwa akitokea kule Wizara ya Afya, lakini pia tumesikiliza mengi kutoka kwa mkurugenzi mtendaji wa hospitali hii ya Benjamin Mkapa, Profesa Abel Makubi. Wote wamewasisitiza washiriki wa mkutano huu kutumia mafunzo walioyapata kwa uzuri kabisa kwa ajili ya kusaidia jamii ya Watanzania. Nikukumbusha tu kuendelea kuifuatilia SQF TV kwa ajili ya mambo mbalimbali ambayo tutakuwa tukikuletea moja kwa moja kutoka hapa Benjamin Mkapa Stadium, Benjamin Mkapa Hospital, hospitali ya Benjamin Mkapa. Kumlazi mtazamaji, haya ni mambo ya kuchanganya mafaili. Ni hospitali ya Benjamin Mkapa hapa jijini Dodoma, sio Benjamin Stadium. Safi kabisa. Na mpaka wakati huu sina la ziada kutokea ukumbi huu wa mikutano hapa katika hospitali hii ya Benjamin Mkapa. Nikutakie utazamaji mwema wa vipindi ambavyo vinaendelea hapa SQF TV. Jina langu ni Pantale Urugwisha.
The Same Qualities Foundation kwa kushirikiana na hospitali ya Lumumba Zanzibar wanakuletea upasuaji wa midomo wazi utakaofanyika bure kabisa. Ni kuanzia tarehe 7 hadi 11 Aprili. Mahali ni hospitali ya mkoa ya Lumumba Zanzibar. Mzazi unaomba kumfikisha mwanao hospitalini hapo siku moja kabla ya kuanza kwa zoezi la upasuaji. Kwa mawasiliano zaidi tupigie simu nambari 0776 177 742 au 0738 229 na 0717 531 312. The Same Qualities Foundation, hatua moja, tabasamu moja.